Good day, I'm Chanel Margaret Valde, and today I'll perform Essential Intrapartal Newborn Care, or the EINC. Good day everyone, I'm Chanel Margaret Valde from BSN 2A, and today I'll perform Essential Intrapartal Newborn Care, or the EINC. In 2009, the Department of Health issued an administrative order number 2009-0025 for the nationwide adaptation of the new policies and protocols for the essential intrapartal newborn care. This is popularly known as the Unang Yakap, or the First Embrace. Through EINC, it promotes evidence-based newborn care practices and eliminate the traditional-based newborn care, which includes routine suctioning, immediate bathing, and immediate cord clamping that leaves no chance to initiate initial breastfeeding. And for the materials, we will be needing sterile gloves to prevent complications, 2 sets of baby blanket, a bonnet to keep the infant warm, a name tag for the identification of the infant, notepad and a pen for the documentation, 1 Kelly forceps and 1 surgical scissor for the umbilical cord cutting, 1 sterile plastic umbilical cord clamp, tape measure for the anthropometric measurement, stethoscope to check for the newborn's pulse for the Apgar scoring, weighing scale to measure the birth weight of the infant. And we'll begin the procedure with the assessment. Good day, ma'am. I'm Chanel Valde, and I'll be your attending nurse for today. So today, ma'am, I will help and guide you for the delivery of your baby. Check the temperature of the delivery room. The normal temperature ranges from 25 to 28 degrees Celsius, and that is to prevent hypothermia of the baby and for temperature regulation. And then check for imminent delivery such as rupture of membrane, perineal bulging, and crowning. Rupture membrane, it may indicate that the labor begins. This membrane is what we usually refer as the bag of water, and it is a sudden gush or scanty, clear fluid flowing from the vagina of the mother. And perineal bulging and crowning, those are signs that the presenting part of the fetus is in the vaginal canal and it is ready for delivery. And then for the planning, notify all the appropriate staff. It is important that all the staffs that are needed for the procedure are present so that there would be a safe and smooth delivery. And also, if ever that there would be unexpected situations, it is important that all the staffs are present so that we could act immediately and prevent further complications. And then arrange the materials in linear fashion, since in this procedure we will be needing to proceed from one stage to another, and it is important to gather and prepare all the necessary materials to save time and effort. Also, check resuscitation equipment such as ambo bag or laryngoscope for ventilation, because not all babies are well. And in case that there would be difficulty in breathing, it is important that all the resuscitation equipments are present and available to address the problem immediately and prevent further complications. And then now we'll begin the procedure. So our client, first check if your client is comfortable. Our client is in lithotomy position. This position facilitates exposure of the perineal area. And this is the ideal position for vaginal birth. And then wash your hands with clean water and soap to prevent cross-contamination of microorganisms. And then perform double gloving just before the delivery. This is to ensure sterility, and since we will be handling the baby as well as the mother, we need to prevent contamination that may affect the maternal and fetal health. And so that we could prevent complications. Now we're done in the double gloving. Ma'am, please come down. Inhale, exhale, and then push. Alright? Inhale, exhale, and then push. And then call out for the time of birth. So baby girl out, 10:30 a.m. And then place the infant or the newborn in the abdomen of the mother, since the weight of the infant also helps the uterus to contract. And then dry the newborn for at least 30 seconds by wiping the eyes, the face, the head, the front and back, the arms and the legs. One of the most important needs of the baby after delivery is a clear airway for her to breathe effectively, and that is achieved through wiping the face of the baby. And also, through immediate and thorough drying, we can achieve heat regulation. So we need to wipe the fluids and the blood, but remember not to wipe the vernix, since it provides a natural cover that protects the baby. So after 30 seconds of thorough drying, remove the wet cloth to prevent hypothermia, since it is already wet. And then next, do an initial or a quick check of breathing. Do not ventilate unless there is no breathing, and do not suction unless the mouth and the nose of the newborn is blocked with secretions and other materials. And then perform the initial Apgar scoring. Apgar scoring was developed by Dr. Virginia Apgar, so it's a method that we use to assess the newborn's adjustment in the extrauterine life. It is taken after 1 minute and 5 minutes of birth. And now we will get the initial Apgar score, which usually indicates necessity for resuscitation. So for the A is for the appearance. As we can see, the color of the baby is pinkish, so the score is 2. And then for the pulse, we will be getting the pulse through a stethoscope. So we will obtain the apical pulse of the baby. So after 1 minute, the pulse of the baby is at 145 beats per minute, and the Apgar score is 2. And then next is for the grimace. So there's a grimace on stimulation, so the score is 1. For the activity, there's some flexion, so the score is also 1. And lastly, for the respiration, the baby shows irregular cries and slow, and the score is also 1. So the total Apgar score for the initial Apgar scoring is 7, and it signifies normal and good adjustment in the extrauterine life. After performing the initial Apgar scoring, if the baby is breathing and crying, place the baby in prone position in the mother's abdomen or chest. And then cover the newborn's head with a bonnet. And also cover the newborn's back with a dry blanket to keep the infant warm. And then place an identification band on the right ankle of the infant. The identification band contains the necessary data such as the baby girl surname or the baby boy surname, the name of the mother, the time of birth, which is 10:30 a.m., and the date of birth, which is today, October 19, 2021, and this is to easily identify the baby. And then now we can remove the first set of our gloves. And this step is prior in handling the umbilical cord. So we need to wait for the umbilical pulsation to stop before clamping and cutting the cord to prevent anemia and to protect the baby from intraventricular hemorrhages. So after the umbilical pulsation has stopped, usually it takes 1 to 3 minutes. Clamp the cord using a sterile plastic umbilical cord clamp. So clamp the cord at 2 cm from the umbilical base. And then strip away the cord from the baby. And then clamp again using a forceps at 5 cm from the base of the umbilicus. squeezing the blood along the umbilical cord, it promotes blood or improves blood volume of the baby, which also improves the baby's health. And then cut the cord near the clamp so that there's no need for second trim. And remember, avoid blind cutting to avoid injuries. And then after the cord clamping, perform subsequent Apgar scoring. So this is usually the 5-minute score, which is more reliable and predicts mortality and neurologic defects. So if we're going to observe the baby's appearance, the upper extremities of the baby is pinkish. However, the baby has blue extremities, and that is still normal, since it is normal for newborns to have acrocyanosis, which because after some hours or time, the baby's color will return to normal again. So the score is 1, and then next is for the pulse. Again, we're going to get the apical pulse of the baby. So after 1 minute, the pulse of the baby is at 140 beats per minute. And the score for pulse is 2. And then next is for the grimace. So there's a cry on stimulation, so the score is 2. And next is for the activity. So the baby has flexed limbs that resist to extension. The score is also 2. And the baby exhibits strong cry, so the score for respiration is 2. So the total Apgar score of the newborn is 9, which signifies normal and good adjustment in the extrauterine life. After that, we're going to deliver the placenta, check the mother's condition, and clean the perineum. In delivering the placenta, we need to watch out for signs that the placenta is separating from the endometrial cells. This includes the Calkin signs. It indicates that the uterus is contracted, in which the uterus becomes round and firm, rise high to the level of the umbilicus. So, if the placenta is ready to be delivered, using the Rietvens maneuver, jack the cord slowly. The placenta must be in a leak-proof container. There are 2 types of delivery of placenta. And at this case, the placenta is Duncan, since it presents the maternal surface in a raw, beefy, red, and has irregular shape. The other one is Colts, in which it is a type of delivery of placenta in which it separates in the center and it presents the fetal surface and it is shiny when delivered. And then now observe the mother's condition. So check for abnormal bleeding, if there's a abnormal or severe lacerations or tearing. And also perform perineal care. We can use a perineal cloth, napkin, or pad. And then after that, leave the baby in skin-to-skin contact with the mother for at least 90 minutes to initiate initial breastfeeding. This also promotes bond between the mother and the baby, and this allows good colonization of good bacteria and to protect the baby from any microorganisms. And then after 30 minutes or an hour, we can observe for breastfeeding cues such as tonguing, licking, gluting movements, mouth opening of the baby, movement of the baby's head as if it is looking for the mother's nipples, or clenching of fist and hands and then placing it on tummy. Also, if the baby places her hands on her mouth or fascines, this cues indicates that the baby is ready to breastfeed. Ma'am, I encourage you to nudge your baby closer towards your chest for her to seek out for your nipples. And then after the breastfeeding is completed and the baby detaches herself from the nipple of the mother, we can now obtain or proceed in obtaining the anthropometric measurement of the baby. So using a tape measure, measure the head circumference of the baby from the center of the forehead to the occipital prominence, or at the level of the eyebrows of the baby. Take note of the head circumference according to the hospital's policy. So the head circumference of the baby is 33 centimeters, and that is normal since the normal range for head circumference is between 33 to 35 centimeters and the average is 35 centimeters. Usually the head circumference, it increases by 1 centimeter per month, and also it is the quarter of the total birth length. Usually, the head circumference can be equal or greater than by 2 centimeter in the chest circumference. And then now, measure the chest circumference of the baby at the level of the nipples. So the chest circumference of the baby is 30 centimeters, and that is also normal since the normal range of chest circumference ranges from 30 to 32 centimeters. Remember that baby who has chest circumference less than 30 centimeters indicates signs of prematurity. And then also measure the abdominal circumference at the level of the umbilicus, and take note of the abdominal circumference according to the hospital's policy. So the abdominal circumference is 30 centimeters. It is approximately the same with the chest circumference. And usually the neonate's abdomen enlarges after feeding due to lax abdominal muscles. And then after that, measure the length of the baby from crown to rump and then rump to heel. So the baby is in side lying position. So the birth length of the baby is 47 centimeters, and that is also normal since the normal range of birth length is 45 to 55 centimeters. And the average is 50 centimeters. Usually, female infants are shorter or one half inch shorter than male infants, and the average birth length of male infants is 50 centimeters, while the average birth length of female infant is 49 centimeters. And take note that infant with birth length less than 47 centimeters shows a sign of prematurity. After that, place the infant in supine position in the weighing scale and take note of the birth weight according to the hospital's policy, similar to and how we have obtained the birth length. We need also to take note of that according to the hospital's policy. So the birth weight of the infant is 3.5 kilograms. In grams, the normal birth weight of infant is between 2,000 grams to 4,500 grams. And the average is 3,500 grams. The male infants are usually heavier than female infants, so they usually weigh in 7.5 pounds, while female infants usually weigh 7 pounds. And Filipino infants, the average weight of Filipino infants is 3,000 grams. Now, we have obtained the anthropometric measurement. We need to record all the data that we have obtained in the notepad using a pen. And then now we can remove our gloves. Discard the used gloves properly in the appropriate receptacle. For the evaluation phase, evaluate the overall mother and newborn's condition. We need to evaluate the condition of the mother during the delivery and after the delivery. If there's heavy bleedings similar to what we have observed earlier, if there's laceration, and also we need to observe the baby. And then for the documentation, record the pertinent data on the mother and the newborn's assessment record. We're going to record the Apgar score that we have obtained 1 minute and 5 minutes after birth. Also, the condition of the mother, we need to record in the assessment record the anthropometric measurement such as the head circumference, chest circumference, abdominal circumference, and the birth length and the birth weight of the baby. It is important to record all the procedures that we have done, including the rationale, because everything that is not properly documented is considered as not done. And that's the end of the demonstration. Thank you and God bless.